Leia Healthcare, looking after you always. Proud sponsors of Real Health with Carl Henry.
Hello and welcome to Real Health with me, Carl Henry, in association with Leia Healthcare. Folks, in this week's show, we'll be discussing all things skin health with Consultant Dermatologist Professor Nicola Ralph. From acne to how to protect against skin cancer, we're covering absolutely everything. As skincare is becoming more and more popular, with 54% of people in Ireland suffering with a skin issue, we're going to find out about the causes and the treatments and the most common concerns people have. Nicola, welcome to the show. How's it going?
Great, thanks for having me, Carl.
This is going to be really popular, I think. It's a big topic. It's become more and more popular in terms of what people are writing about and talking about in the press. I think it's really important to have a topic like this on the podcast. People are aware of it and partake in it, but what are the most common skin conditions people deal with? I know that's a really big question to open, but we'll go there anyway.
There are so many, because there are somewhere between 2,500 and 3,000 different skin conditions worldwide. But I suppose the commonest diseases that would affect the skin worldwide would be acne, eczema, psoriasis, and skin cancer. So they would be the most common conditions that I would see coming into my clinic on a daily basis. And you know, if you're to look back over your life, we've all suffered with, you know, a touch of teenage acne. Obviously some only minor, some more severe, and we all know someone who suffers with dermatitis or eczema, or maybe a family member who has psoriasis, or maybe someone who's had a skin cancer. So pretty much everyone knows someone who has suffered with their skin at some point.
And is there anything particular to, I suppose, Irish people or that Celtic complexion that we're predisposed to, or it's more of a concern for Irish people?
Yeah, so I suppose we are high risk for skin cancer, and we also have what we call the curse of the Celts, which is rosacea. So rosacea is a chronic inflammatory skin condition that normally has an adult onset. So the commonest peak is in your 30s and 40s, where you develop redness on the face, particularly the cheeks, the nose, center forehead, center chin, and you may get spots, so little red papules or little whiteheads in that location too. And patients would tell you that they have a tendency to flush. So particularly if they were a bit stressed, or they're in a warm environment, they had a glass of wine, they went for a run, that they have redness of their face. So that's what we call the curse of the Celts, and that would affect about 1 in 10 Irish adults. So very, very common. And often, patients would certainly say, my dad has a tendency to have a high color or be red. So a lot of people seeking treatment for that in the last 2 years. So there's been a lot of flares of not only body skin conditions, but particularly the skin that on your face, because of mask wearing. We've seen a lot of triggers, not only just of maskne, but of acne, of dermatitis.
Maskne, I love that.
Yeah. So, and it's true. It's not a makey-uppy term. We added the M in front of acne, but it's definitely maskne. And we've seen a lot of that, even in patients who didn't previously suffer with acne, unfortunately, because of the constant use of masks, which obviously have a very important benefit to all of us. But we've seen a lot of people presenting with the first time onset of acne, having never had it before, particularly frontline workers, particularly in 2020, when the masks were just constant, 12, 14-hour shifts, and constantly having this friction on your skin. And really the mask created the perfect environment. You had the humidity behind the mask, which is great for bacterial growth, and then you have the friction of the mask rubbing off that top layer of your skin, which is stimulating the oil glands. So it's basically the perfect microenvironment for bacteria to grow, and that's why lots of people have suffered with maskne in the last 2 years.
And let's stay with that for a sec. So if anyone listening in is suffering from that, what do they do? Do you change your mask? Is there a certain type of mask? Do you, what's the best thing to deal with it?
So there are plenty of little tips. I suppose for those who have to wear it all the time, it doesn't really affect someone who's just going to the shop for 15 minutes as much as someone who's in it for prolonged periods of time. But I mean, ideally, you're going to have a clean mask every day. So if you're a frontline worker, unfortunately, you do have to wear the tighter fitting masks because they are more protective. And certainly the tighter fitting masks do create more friction on the skin. So, if you're not a frontline worker and you don't have to wear the tight fitting one, certainly silk masks or material or cotton masks are more gentle on the skin. Moving up to the surgical mask is a little bit more tight fitting, and then the FFP2s or the KN95s are the tightest fitting. So you've definitely seen more severe maskne in those with the tighter fitting masks. So if you don't have to wear them, wear a lighter fitting one. Change it daily. So certainly if you're going to use a surgical mask, you have to have a clean one every single day, and if you're going to use material, you have to wash it and have a clean one every day. If you can avoid wearing makeup underneath them and take breaks, definitely avoid the makeup to let your skin breathe, and absolutely have to wash your face every night before bedtime. So ideally a double cleanse where you're using something like a micellar water to break up the oil that's built up over the day, the dead skin cells, the SPF you might be wearing, the makeup, and then a creamy cleanser for those with more sensitive skin, or a foaming or gel cleanser for those with more oily skin. So every single night, and a clean pillow every single week, because all of our oil and our dead skin cells builds up. So change your pillowcase as well.
A clean pillow. I chat to people on Instagram about hoovering your mattress and stuff all the time. I actually never thought about the pillow, but you're totally right. Because that's where the dead skin cells, they're going to hang out there. They're going to live there.
8 to 10 hours if you're lucky enough to get that much sleep, and your skin is in contact with that pillow. So definitely clean pillowcase. And for anyone who wears makeup, don't forget to wash your makeup brushes. They sit in the bottom of our makeup bag. Just throw them in day after day, covered in bacteria. So definitely wash them once a week if possible as well.
There's a lot of cleaning and washing going on here.
A lot of high maintenance, yeah.
Absolutely. Talk to me about rosacea then. What caused it, and what can you do to prevent it or treat it? Talk us through that. Yeah,
sure. So it's multifactorial. So there's a genetic predisposition to it, as I said, about 1 in 10 Irish adults. So you may have a family member before you who suffer with it. There's definitely an interaction between bacteria on the skin surface and a mite called Demodex. So we all have millions of bacteria on our skin, and we also have this mite. But funnily enough, patients who suffer with rosacea don't have millions more of this mite on their skin compared to somebody who doesn't. UV light triggers it. So the most important thing is hail, rain or snow, wear your sunscreen 365 days a year. I think a lot of Irish people unfortunately think that, it has to be clear blue sky, 25 degrees in order to get either sun damage from a skin cancer point of view or trigger the rosacea. But when you look at the studies and the physics behind it, the only month of the year that you can't really get UV damage in Ireland is January. And then every other month there is enough UV which is coming through your window when you're driving your car. A lot of people working from home in the last 2 years sitting beside a window, and they may notice that the rosacea is worse on the right side of their face. That's the side we drive. Or they may notice that they're getting more skin cancers on the right side of their face because of the UV that comes through glass. So UVA, A for all year, so it's present all year round, and it does come through glass. So it's not only important when you're going for your walk or exercising or playing golf when you're outside to put on your sunscreen, it's all year round. So that's the most important thing. Unfortunately, there isn't a cure for rosacea where you take a tablet for a month or you put a cream on for a month. It is about maintenance. So most patients will be using their broad spectrum physical or mineral sunscreen every single morning and reapplying it obviously in the warmer, better weather. And then they would often be prescribed a prescription topical antibiotic or topical antiparasitic, as well as taking oral tetracycline antibiotics to bring that initial flare under control. And then the best treatment for the redness, which is where people see flushing, they have those broken capillaries across their cheeks and their nose, is IPL, or intense pulse light. So it's not a true laser, but it's working by kind of constricting then those blood vessels. And then if you don't have the blood vessels, you don't have this permanent redness, and then you don't flush as easily if you get warm or stressed, for example.
Okay. Lots to take in there. Absolutely. It's very, very common. It's 1 in 10, I think you were saying, wasn't it?
Yeah, super common. And I think, a lot more men presenting with it in the last 2 years, because obviously we get up in the morning, you have your shower, you brush your teeth, you're out the door, you tend not to look at yourself for another 12 hours until you brush your teeth later on that night. Now everyone's on Microsoft Teams, Zoom, they're basically like in the mirror all day looking at themselves. So a lot more people realizing, God, I do have a tendency to go red, or I'm making a presentation and it looks like I'm nervous when actually I'm not. So a lot more men seeking IPL in the last 2 years for sure.
And that's been that term has been coined, hasn't it? It's the Zoom boom of the fact that we're looking at each other, we're looking at ourselves all the time now, and we're noticing things about our skin that either we're not happy with, or we want to change, or to get treated. Are you seeing that in the clinic?
Yeah, definitely. I mean, as I said, it's not just, we've seen a lot more flares of patients with their psoriasis and their dermatitis, because unfortunately stress has a significant impact on skin conditions. So if you get particularly stressed, and I mean, the last 2 years have been so stressful for people that your general, your eczema, your psoriasis will flare. But certainly with the mask wearing, it's been particularly bad for people on their faces. And then, of course, when you're looking at people all day and, if you flare of your face, it really has a negative impact on your quality of life. And when you look at chronic skin conditions, whether it's, acne in particular, if you do somebody's quality of life index, it's basically a questionnaire of seeing how much a skin condition impacts on them. It's just as significant as having diabetes or asthma or epilepsy. But yet, if someone said, oh, I have epilepsy, you think it would have more of an impact than acne, but acne is just as much. It's a huge amount of people affected by it.
Folks, you're listening to Real Health with me, Carl Henry, in association with Leia Healthcare. We're chatting all things skin care. I'm particularly fascinated in this topic, and this conversation came about because I went to see Nikki because I had a dodgy mole on my arm that I really wasn't happy with. It looked kind of angry, and I went to my GP and I said, what's the crack here? And they said, you need to go get that seen to. Fairly lively. And I went into Nikki. So I want to take the conversation towards skin cancer now, and I suppose starting with that point, which is getting to know your body, getting to know the moles on your body, and keeping an eye on them on a regular basis, because it all begins there, doesn't it?
Yeah, absolutely. I mean, self-surveillance is the most important thing. So getting to know, as you said, your own skin, where your moles are. We all have moles, and we start developing. We're either born with them or we develop them in childhood. So we can still get new moles roughly into our late 30s, but after that you shouldn't be developing significant number of moles. And it really ranges with families. Some families make hardly any moles, and then some families have a lot of moles. And some families do have what we call a dysplastic, atypical type of mole, so it may not look a perfect shape and color, and they're the patients who need to really check in with their GP and then potentially a dermatologist who's having someone else look at them regularly, particularly if you have a significant number. So if you've over 50 moles, you'd be at slightly higher risk of developing a skin cancer. And unfortunately for Irish people, 3 out of 4 Irish people have what we call Fitzpatrick skin type 1 or 2, which is a tendency to burn and never tan, or burn first and then tan. So we are very fair skin, fair eyes, fair hair, and a tendency to, as I said, freckle or burn rather than tan. So most of our damage is done before the age of 20, when we went out, we didn't put our sunscreen on like we were told, and we come back in burnt, and we put yogurt and everything known to man, try to cool our skin down. But sunbeds is another thing to absolutely avoid. And even one sunbed before the age of 35 increases your risk by 60% of developing melanoma. Not to mention the other skin cancers. So the most common skin cancers are called non-melanoma skin cancers. And the commonest two within that group would be basal cell carcinomas, or BCC for short, or squamous cell carcinomas, or SCC for short. And there are about 13,500 cases of non-melanoma skin cancer in Ireland every year, and about 1,100 melanoma skin cancers. And the National Cancer Registry in Ireland actually, unfortunately, predicts that that's going to double by 2040. So we're not out of the woods yet. So it's only going to get worse in the sense of the numbers. So it's so important that this current generation, who are having young children, that they protect them from the day they're born with the style of clothing, the hats, covering the nape of their neck, the UV suits, reapplying the sunscreen every 2 to 3 hours. Unfortunately for the likes of yourself and myself, we probably had a little bit more damage than we would have liked when we were younger. We had the odd sunburn. Certainly blistering sunburn puts you at a higher risk, but we can definitely protect ourselves from now on. So not going out in the sun around solar noon or midday when the sun is at its highest. To put on your sunscreen every 2 hours, and make sure that it's a minimum of a factor of 30 in the winter months and somewhere between 40 and 50 in the summer months. And really doing your exercise at extreme times, so earlier in the morning or later in the afternoon, but coming inside when it's midday basically.
And of course, people, I suppose I would have been one of these people who would have thought, it's only when you lie in the sun that you're tanning, and that's when you put your sun factor on and all that. But if you're like me and you exercise outside a lot, which I do, I run, I cycle, I mountain bike, I surf, whatever, I'm outside all the time, and I wasn't putting on sunscreen at those times, I just wouldn't think about it, because like that, the light, or it's the wrong time of the year, or whatever, just forget. So it is important if you are active outdoors.
Yeah, it's not to do with the temperature. When you're on holidays, if you're in the Mediterranean, you can feel that it's 25, it's 30 degrees. You're going to put your sunscreen on, and most of us actually underuse sunscreen. We tend to bring that one bottle on holidays. It seems to go on everyone, and then you still bring the same bottle home. So certainly too little sunscreen. But really, a full shot glass is what an application be for a whole body, and then that should be reapplied every two hours or so. So if you were to think of only sunscreen as your protection, it's the most expensive form of protection for your skin, whereas seeking the shade, wearing a hat, covering up, that's the cheapest form. Clothing is actually the cheapest, but none of us really like to do that because it's not really cool to wear a wide brim hat. It's just better to get your tan. And there's no point in saying you don't look better. When you're younger, you do look healthier when you have a tan, but unfortunately a tan is just damage. It's those cells lining up on the top layer of your skin, trying to protect yourself like a little army underneath. So the darker you are with your tan, the more damage you've done. And it's only when we get older that unfortunately our skin looks more leathery and it's tougher, and that's the UV damage over the years. So none of us really want to look like that when we get older, but yes, we're kind of willing to take the risk when we're younger. But the self tan is the only way to go. So your self tan or fake tan, certainly not a real tan, and certainly not sunbeds.
I won't be going the fake tan route, that's for sure. So I want to bring people through this process, because I'm intrigued. I'm at that age now, I'm 40. I'm going, you know, I'm looking after. I always looked after my body. I'm looking after myself now. It's important to look at these things. I saw a dodgy mole, didn't like the look of it. GP sent me into yourself. Chat people through that process of because a lot of people have the kind of white coat syndrome, or the fear of, if I go in, oh, it's scary or it's whatever. And I think in terms of skin cancer and reducing the stigma around that, it isn't that at all. You just basically go to someone like yourself. They will check all the moles on your body, and then if needs be, they'll take it further.
Yeah, exactly. So, I mean, you'd basically come in, we'd have a chat, kind of gauge what risks you have. Are you a particularly moly person? Has there been somebody in your family who's had a skin cancer? Are you an outdoors person? Did you have sunburn as a child? Did you use sunbeds? Do you go on regular sun holidays? So I'll be gauging your kind of risk based on those questions. And then we are going to do full skin exam. And I think that's, people kind of get a little bit embarrassed. You know, and some people would like to be covered up with a gown. But the problem is, if we cover you up with a gown, we might miss something. You know, if you don't lift your arm properly. Or,
in all fairness, for the listener in, folks, having gone through this experience, you stand there in your boxers or in your underwear on the
and
doctor.
a mask. Don't forget the mask.
Mask.
That make it even more unusual. Yes, the last 2 years has been a bit funny, but yeah, you are.
And you somebody with a light and a magnifying glass in one yoki going around looking at all your moles, and it isn't as scary as it sounds. Trust me, having been through it, it isn't that bad.
But really, you know, as a dermatologist, everyone thinks, you know, you're stood there and you're being stared at. But my job is to focus right in, you know, on each mole, and I'm focusing on every area and checking the pattern, what the pigment looks like, you know, are there abnormal blood vessels, what the shape of your moles are. And then at the end, you know, you're going to educate the person as to, you know, most people come in and they have normal mole checks and everything's fine, and you can be reassured. Sometimes lesions are totally benign. They're not even a mole. You know, you can get confused between a benign thing and a mole, but lots of things in the body, unfortunately, can look brown. So, you know, people get something new on their skin and they think it's a mole, but then you'll be educated how to look. So you're looking for the A, B, C, D, and E of how to check for changes. So A is for asymmetry, B is for the border, so we like a smooth border, not a jagged edge. C is for the color, so you like an overall one color, not kind of pink or brown in different areas. And D is for the diameter, so roughly less than 6 millimeters. And then E is important, it's for evolution. So if somebody sees something either brand new on their body or something they've had forever, but it's starting to change with the shape, the size, the color, then absolutely go to their GP and get checked. And you know, sometimes their GP will be able to say to them straight away, absolutely fine, nothing to worry about. Or then they may be sent on to a dermatologist for a checkup. And there are lots of people where we take moles off because they're ticking boxes that they look irregular, but they can still come back benign. So even if we take a mole off and it says it's mildly changing, it's moderately changing, it's severely changing, before it ever becomes melanoma, that's still considered benign. But we may sometimes go back and do a second surgery, which is all, you know, done under local anesthetic. So you're in and out in a few minutes, just to make sure that that mole never comes back and causes you any problem in the future. So the most important thing to say to your listeners is that majority of skin cancers are fully curable when you catch them early. So it's early detection that's the most important.
I think we just taken this thing out of the whole worry that people may have there. At least I hope we certainly have. And if you have any, it's generally men who are scared of this kind of stuff. If they're listening in, send the episode on to them, because having been through it and haven't had haven't had the mole removed and gone back for the second check, I can assure you it isn't as scary or as worrying. It's just the peace of mind of having yourself checked out, which is important. I want to pull back to makeup, and for women who are wearing makeup, in terms of how often should they top up over the course of the day? Is 1 factor 50 enough for the whole day? Or just chat us through that a little bit for all the women who are listening in.
So, I mean, if it's in the winter months and you're in Ireland, you want, as I said, a minimum of 30 every day. And that can be applied once a day in the morning before you put your sunscreen. So I think people get confused as to which layer goes on. Is it moisturizer first? Is it sunscreen? The last thing between your skin and the sun's rays should be the sunscreen. So it's moisturizer first, sunscreen, and then of course you can cover your sunscreen with makeup, but therein lies the dilemma: how do you top that up without messing up your makeup? So there are certain products from different brands. I suppose one of my favorite would be Skin Better Science, which has a compact, which is your tinted makeup, and you can dab it onto the skin, so you're not quite ruining your makeup look, and you can put that on throughout the day. And as I said, roughly every 2 to 3 hours if it's particularly sunny. And then another brand that has a really nice ultralight, it's called Anthelios Ultralight from Roche-Posay, you can actually spray it on over and it doesn't make all your makeup run. But yes, if you are going to be out for hours and hours and you've put your makeup on that morning and it's a really sunny day, you certainly want to be topping it up. But in an Irish winter, you should be fine just putting it on once in the morning time.
One concern people may have listening in is that, we've given lots of recommendations, lots of things, is maybe the cost of that. So does healthy skin and minding your skin, is it expensive? Does it have to be expensive? And give us a kind of a sense of that.
No, I mean, it doesn't have to be expensive. In, the last 2 years, we've had more TikTok trends and Instagram and people having these really complicated, like 10 steps at nighttime to take your makeup off and put serums and moisturizers and anti-aging and the same thing each morning. Your whole life will be spent in front of the mirror. If you have the money to spend on just your sunscreen, that is the most anti-aging product that you can use, because 80 to 90% of your wrinkles come from UV exposure over your life. So if you just choose one product, it has to be a good sunscreen every morning. And then if you do want to look into anti-aging, as we start hitting our late 20s, unfortunately, we all start to get older from skin point of view, and our collagen starts to break down roughly from 28 years of age onwards. It will be adding in a retinoid. So they're your main two things, morning and evening. And then you can just use basic moisturizers in between. Yes, some people prefer the texture of a serum over a moisturizer, but you don't have to go spending a lot of money on each of those individual moisturizers and serums. The money should be spent just on your morning sunscreen and your nighttime retinoid, and everything else in between is not, it might be moisturizing you, but it's not going to give you anything from an anti-aging perspective or protect you from skin cancer, and your sunscreen does that.
And chat to me around food and water. So I'm the PT. I'm always telling people, drink your water, eat your vegetables, eat your fruit, because it's going to be good for your health, but also it's very, very good for your skin. Am I right? Am I not right?
No, you're right. As in, obviously, there are certain skin conditions, ultimately they're genetic. And, acne would be a very good example, because patients would say, I think it's just because I ate poorly for the last 5 days and I've had a breakout. Acne is genetic, and then unfortunately our hormones surge as a teenager, and then that kicks our oil glands off, and there we go. We get blocked pores, which are called comedones or blackheads, and then the oily skin makes the perfect environment for bacteria, and then you get the pus bumps and the red spots. But yes, it's really important to have a healthy diet, in that your skin needs protein to heal, and you also need fat in your diet. Now, I don't mean lots of saturated fat, but healthy fats, because you actually have cholesterol ring in your skin, in your surface layer. So if you want to heal up your skin and reduce breakouts, you do need a very balanced diet. So plenty of fruit and vegetables, the proper fats, and not going too much with a high GI diet. So too many carbohydrates or high sugars. And certainly anyone who's kind of fallen off the wagon with their diet and gone with the takeaways regularly will say, I'm having a breakout or my skin just looks dull. So a balanced diet is important. But of course, if you have bad acne based on your genetics, just because you have the healthiest diet and you change everything doesn't mean, unfortunately, for every person that they can bring it under control. So yes, adopt your healthy diet, but if you are suffering with it, you should certainly go to your GP to get put on some medical treatment to help you with your acne.
Folks, every now and again we interview somebody who we could just go on and on and on and keep the episode running for another half an hour, which unfortunately we don't have time for. So what I am going to say, we're going to do something a little bit different now. If you have any skin related questions, do send us an email, realhealth@independent.ie, and we may do second ep later on in the future, and we'll put all those questions to Nikki if she'll come back on and join us. Nikki, if people want to contact you, where can they find you?
So I'm based in the Institute of Dermatologists in Ballsbridge, and there's actually there's 7 of us, 7 consultant dermatologists in the one clinic. So we cover all aspects of medical and surgical dermatology, and we also have the cosmetic suite. So for patients who are looking for anti-aging or boosting their skin, or IPL, when we've covered rosacea, everyone could benefit from IPL. We're based in IDI in Ballsbridge.
Amazing. And you're on Instagram as well?
Absolutely. So the Institute of Dermatologists is on Instagram, and I have my own personal Instagram, so Dr. Nicola Ralph.
Fantastic, Nikki. It's been great to catch up with you, and thank you for all the work that you did on the mole on my arm. I feel very reassured that it's safe now. Thank you.
Great, delighted to help, and thank you so much for having me on.
Folks, do send us in your questions by email, realhealth@independent.ie. That's it for another episode of Real Health with me, Carl Henry, in association with Leia Healthcare. As ever, you know where we are, at Carl Henry PT on Twitter and on Instagram. We'll see you next week for more Real Health. Slán go fóill.
Leia Healthcare, looking after you always. Proud sponsors of Real Health with Carl Henry.